All right, let's head over to the UK now. The country's health minister has been diagnosed with coronavirus. Nadine Dorries first showed symptoms on Thursday. She attended a Downing Street event hosted by the Prime Minister on the very same day. Now, 6 people have died in the UK so far. But let's get the latest from our correspondent, Ollie Barrett, who joins me now, of course, from London. Ollie, thank you for your time. I mean, let's talk about perhaps if we have information of where and how the health minister contracted coronavirus.
No, it does not seem at all clear where Nadine Dorries may have picked up COVID-19 coronavirus from. That is one of the worries more broadly about the way that the outbreak is headed in the UK at the moment, is that there does seem now to be more and more cases of what's known as in-community transmission. So that is people picking up coronavirus from other people in the UK, not from foreign travels or from people who have come back from other countries. So we don't know exactly who Nadine Dorries picked this up from, but they are at health level making attempts to try and get in touch with as many people as possible that Nadine Dorries has been in contact with in the last week or so. The difficulty, of course, is that as a Member of Parliament, that is hundreds and hundreds of people. She attended an event with Boris Johnson. She had a surgery in her constituency attended by dozens of people as well. And that's one of the real concerns about parliamentarians at Westminster, is that they come to London for several days a week. They meet with all sorts of people here at the parliamentary estate. They're in the chamber in the House of Commons. And then towards the end of the week and at the weekend, they go back to their constituencies and hold meetings with dozens of other people there. So real worries now about Westminster, and calls in some quarters for the Houses of Parliament to be shut down at some point for a period.
I understand that. And I mean, also in a tweet, she also expressed her concern because she said she's more worried about her 84-year-old mother, whom she resides with. And she also said that she's been showing signs of coughing. So clearly, there's an appeal that those who've been around her, whether family, friends, or even members of Parliament, including the Prime Minister, need to ensure that they contact the public health facility.
That's right, and we've just heard from Downing Street, actually, that at the moment Boris Johnson, the Prime Minister, has no plans to be tested for COVID-19 because he is following what remains, and could change at some point, the current advice here in the UK, which is that if you are showing no symptoms, there is no need, unless you have been in contact with someone that you know has had COVID-19 or has travelled from one of the outbreak regions, you don't need to be tested under current rules and current advice and guidance. But certainly there will be various health officials who have been in contact with Nadine Dorries who may need at some point to get themselves tested. The event that Nadine Dorries attended with the Prime Minister, we understand she didn't get particularly close to him or spend a large amount of time in his presence. So I think that is why Downing Street is not heading down the route at the moment of getting the Prime Minister himself tested for COVID-19. But it really does illustrate the kind of concerns that are moving around Westminster, and the fact that our governing class, the people who are supposed to be handling this outbreak, can be directly affected themselves.
Yeah, and I just wanted to ask you, Ollie, and I'm glad you raised that point, because we're speaking about a health minister who obviously engages with other health officials, and these could include doctors. Is there some sort of fear that perhaps even medical doctors who are meant to assist patients and, you know, help treat this virus could equally be exposed?
Absolutely there is, and I think, you know, health officials here in the UK are well aware of the heightened risk that some of them will be facing in the coming days and weeks, if not months. At the same time, we've also heard measures being discussed in terms of contingencies about how the National Health Service here in Britain may need to move and respond if we do head into a peak outbreak scenario. One of those contingency plans that has been suggested is that some retired doctors and nurses may need to be contacted and brought back into the profession temporarily to boost the numbers of health staff that are on the ground. And that is also why, taking a panoramic view of this, the UK really wants to double down on that idea of delaying the spread of coronavirus here in Britain, to try and spread out that peak so that you don't have that really concentrated couple of week period when tens of thousands of people may need hospital treatment and put a real burden on the National Health Service. We also have the budget being revealed here in the UK in around an hour or so from now by the Chancellor Rishi Sunak. He is going to also outline some measures and probably some extra support and funding for the National Health Service as well.
Yeah, and Ollie, I mean, when we look at the numbers right now, and please correct me if I'm wrong here, or if perhaps the numbers have fluctuated, but 382 confirmed cases in the UK, 6 people have died. These are just some of the numbers that I have in front of me, but could this be the reason why the NHS is planning to ramp up its capacity in terms of more testing facilities within the UK?
Yes, we are heading into that stage where it really becomes less about containment and more about trying to delay the spread of the outbreak. Health officials and advisors here in the UK and the government as well are being very clear. This outbreak is going to spread pretty significantly from where we find ourselves at the moment. Those numbers you were giving are accurate as of now. We will hear an update from the Department of Health in about 2.5 hours from now, and we will expect to hear where we have now got to in terms of confirmed cases and, unfortunately, perhaps further potential confirmed fatalities. But everyone in the UK at National Health Service level is very clear that this outbreak is going to spread, and at a point in the not-too-distant future there is going to be significant strain on the NHS. That is why the government is trying to delay the spread so that we can get out of what is already a winter flu season when the NHS is already under significant pressure. So yes, that increased testing is going to be important, and it may also therefore be that when we head into the next phases of the outbreak that we see some of those other contingencies being used by the government, bringing in the armed forces if they're necessary, encouraging people to work from home at times, perhaps shutting down some public gatherings. We've seen tonight's match in the Premier League between Arsenal and Manchester City has been postponed. We may see some more football matches postponed at some point. So there are lots of contingencies that the government still has in its pocket, that it hasn't used yet, that it hopes it doesn't have to use all of them, but certainly we are moving through those phases of this outbreak here in the UK.